In 2003, Georgia was fighting the perception that better cancer care was available elsewhere, notably in neighboring states with leading cancer centers, while care in Georgia was provided through unlinked hospitals and practices that offered few clinical trials. Because clinical trials represent the leading edge of cancer treatment and quality care, Georgia Core focused on increasing their access and availability. Community and academic oncologists designed a research network, not to serve one institution or region of the state, but to ensure equitable distribution of trials and treatments and to improve outcomes for patients and survivors. Georgia Core seeks to expand our statewide reach and increase access to quality cancer care. To do this, we engage experts, patients, and survivors in cancer advocacy. We improve education and resources for cancer patient navigators and establish new channels for providers to exchange best and promising practices. We also conduct clinical research that improves both quality of care and quality of life for patients and create working groups to explore emerging issues as our understanding of cancer evolves. This multi-pronged strategy unites the state's cancer community and establishes links between patients, survivors, and caregivers. Georgia Core was created as a critical component of the state's Strategic Cancer Initiative. With early support from the governor and the state legislature, we were able to attract top scientists, clinicians, and educators. Leaders from various disciplines and institutions find common ground in Georgia Core and value collaboration that leads to improvements in quality and access to care. Georgia Core is now a public-private partnership with a balanced blend of resources that contributes to the organization's sustainability and independence. We provide an innovative mechanism for doctors, nurses, scientists, educators, navigators, and public health professionals to achieve collective impact. We promote cancer prevention, screening, and risk reduction. We accelerate the exchange of knowledge and best practices to prevent, diagnose, and treat cancer. And we equip our healthcare providers, cancer centers, and nonprofit organizations with the tools and resources necessary to provide comprehensive, patient-centered care. Through its affiliates and partners, Georgia Core has impacted the availability of clinical trials in our state, which have increased 80% in the last 4 years. A majority of these are Phase 1 and Phase 2 trials in leading cancer types, breast, colorectal, lung, and we also offer trials for more rare forms such as bladder and pancreatic cancers. Participation in clinical trials has increased, notably among minorities who represent approximately 25% of patients enrolled in Georgia Core-sponsored studies. Access to clinical trials has increased, with 42% of them offered in rural Georgia, where nearly half the population resides. And there is increased collaboration among cancer care professionals in that 90% of the oncologists who diagnose and treat cancer patients in Georgia are affiliated with Georgia Core. When Georgia Core was created, we were known for having an exclusive focus on clinical trials. Since then, our scope has grown to fully leverage the impact of sharing knowledge, expertise, and best practices across disciplines. Also, people sometimes mistakenly assume that we are fully funded by the state, but the truth is we're also dependent on the generous support of private donors. We created an online cancer information center called GeorgiaCancerInfo.org for patients, survivors, and caregivers, providing details on oncologists, cancer centers, treatment options, clinical trials, and cancer resources available in Georgia. And we developed a unique process with the National Cancer Institute to ensure that this information is accurate and current. We were awarded a contract by the Georgia Department of Public Health with funding from the Centers for Disease Control to create a statewide breast cancer genomic health consortium. With academic partners and public health, we are screening high-risk and minority women for hereditary breast and ovarian cancer and working with healthcare providers to offer follow-up care. Georgia is one of the first states to develop an organization for cancer patient navigators, and with our partner, the Georgia Society of Clinical Oncology, Georgia Corps provides resources for its 275 members. We began as a governor's initiative, but with changes in our state government, we've experienced dramatic reductions in state funding. Due to our dependence on soft money, the current business environment requires that a significant amount of time be spent generating financial support when we'd rather be caring for patients. Our organization has demonstrated proof of concept in several key programs, but taking these needed and innovative initiatives to scale requires sustainability and backbone infrastructure. We would establish a call center with a patient navigator who could assist patients, families, professionals, and caregivers in finding the most appropriate cancer care and resources. We would strengthen our research program by employing a medical officer who would locate leading-edge trials that we could bring to Georgia and a full-time research program manager to ensure that we have the capacity to operate those trials. We would provide direct support to the more than 40 accredited hospital cancer centers in Georgia, leveraging their resources and ours to meet new evidence-based guidelines. And a top priority for us continues to be increasing visitors to GeorgiaCancerInfo.org, so additional resources would be used to expand its statewide public awareness campaign. Disparities in cancer care and outcomes continue to be a persistent problem. With academic and community partners, we are well suited to develop and implement a statewide effort that improves cancer care equity among minorities, rural populations, and those at risk of hereditary cancers. Given additional resources, our network could implement the strategies, and Georgia Corps would collect data to monitor outcomes and evaluate impact.